Minister Jason Copping, Infrastructure Minister Prasad Panda, and Seniors and Housing Minister Josephine Pon. Also joining us for this event are Dr. Sid Viner, Vice President and Medical Director for the Clinical Operations of AHS, and Shauna Siverson, Board Chair of CareWest, plus Kareem Kassam, Vice Chair and Treasurer of the Alberta Continuing Care Association. That's the group of organizations, both nonprofit and businesses, who help to operate the nursing homes all across Alberta. Now, Budget 2022 makes historic investments in our healthcare system. Not only is Alberta's government spending at a record amount on healthcare, we're also investing in the infrastructure to build more capacity. And one thing we learned through COVID is we need that additional capacity. That's the central priority of Budget 2022. Albertans need a healthcare system that provides care when and where it's needed, anywhere in this big province. And that's why we're making a commitment today to expand continuing care capacity across Alberta and to increase services for seniors. It includes nearly $3.7 billion in operating funds across the continuing care system, and that is a 6.3% increase over last year. Albertans can take a comfort knowing that their loved ones will receive high-quality care in their homes or their communities and in continuing care homes, no matter where they live. We also are thinking about the future, because by 2040 there will be more than 1.1 million seniors aged 65 plus in Alberta. So to meet the needs of our aging population, Alberta's government is investing $204 million in capital funding over the next 3 years to modernize and increase continuing care capacity across Alberta. Minister Copping will provide more details about the new capital funding and operational funding, how it will be used. But I'd like to highlight Alberta's commitment to expand healthcare capacity with two major capital projects that are under construction right now in Alberta's major urban centres. As part of Alberta's recovery plan, we've allocated $91 million over 3 years to finish construction of the Bridgeland Riverside Continuing Care Centre, which is great news for Calgary. There's also an additional $142 million over 2 years for Edmonton to complete the Jean Zwozdesky Centre. We're committed to support innovative, quality infrastructure projects like these that will increase continuing care capacity, ensuring our seniors get the care and service they need. And let me pause to say that the increasing capacity on the continuing care side, be it home care or nursing homes, community care, is really important, because one of the long-term problems that we've experienced in Alberta's healthcare system is a lot of seniors who are in acute care beds in our hospitals who could be getting a better and more appropriate care in different settings like home care and nursing homes. And every day, every night that they're in an acute care bed in a hospital costs us as taxpayers a lot more to care for them in an acute care hospital setting, but it also limits the number of available beds. And that's one of the challenges that we and other provinces faced throughout COVID when we reached some of those peaks that were challenging hospital capacity, is that we were running into a situation where there were, typically in Alberta, about 18% of our acute care beds have been occupied by seniors who could be better cared for in home care, nursing care, and other services. So expanding this capacity, as we are doing here today, is a key part of our strategy to increase overall capacity so we don't face the kind of difficult choices that we did. And I'm so excited that today's announcement will result in an increase of 1,515 new continuing care spaces over the next fiscal year. I just also want to add that in addition to this overall increase, there's an increase of $122 million, or 7.6% increase for community care, as well as a $750 million increase for home care, and that represents an $81 million, or 12% increase, again, in this year's budget. So these are big and important investments, a big part of our strategy to increase capacity, a key learning from the COVID era, so that we can, frankly, provide better care for seniors in their communities, but also open up more capacity in our hospitals and help them to run more efficiently too. It's a win-win. So since we're in Calgary today, I want to highlight how this Bridgeland Riverside Continuing Care Centre will strengthen the delivery of continuing care and other healthcare services more broadly in this city. The Bridgeland Riverside Continuing Care Centre will be a hub for many seniors that live in surrounding neighbourhoods and other parts of the city who need access to health services nearby. Not only will the centre accommodate about 200 residents, it will provide a range of care and services to seniors and others with complex needs like people with dementia or those suffering from brain injury. This will also relieve pressure on Calgary hospitals, as I say, by reducing the number of people waiting in acute care for a continuing care space. It will help meet the healthcare needs of Calgarians for years and years to come. And more importantly, it will support health services delivery as Calgary and Alberta prepare for an aging population in the years ahead. I've said this many times before, and I'll say it again, that Alberta seniors built this province, and we're standing by them every step of the way. The public health orders for continuing care remain in place to protect the health and well-being of seniors, and we're moving forward for Albertans on our path to recovery. And with that, I will invite the Minister of Health, Jason Copping, to add some more details.
Thank you, Premier, and good morning, everyone. I want to thank you all for joining us today, and I want to thank AHS for allowing us to make the presentation here in their facility. As the Premier mentioned, Budget 2022 is a milestone for our health system. And today we're here to talk a bit more about what it means for continuing care. Let me say right up front, it means more spaces, better access, and shorter wait times for continuing care here in Calgary and across the entire province. And that's not just sometime in the future. It's right now and right through this coming year. As the Premier noted, Budget 2022 includes nearly $3.7 billion in operating funds for the continuing care system, a 6.3% increase over last year. And the funding breakdowns as follows: $1.2 billion for long-term care, $1.7 billion for community care, which includes designated supported living, and $750 million for home care. The budget will support opening 1,500 new continuing care spaces across the province in 22-23, and we'll share the details on where they'll be opening in the coming months. Budget 22 also provides $204 million in capital funding over the 3 years to modernize existing continuing care facilities across the province and develop new spaces in priority communities. We'll work with community, nonprofit, and independent providers to achieve this through the Continuing Care Capital Program. Like I said earlier, we're adding spaces right now, and we'll keep adding them right through the coming year. In fact, today, AHS is announcing the opening of a facility in Hinton with 32 new supportive living beds, the Evergreens Foundation Pine Valley Lodge. We need to have the right spaces available when people need them and where they need them. And I want to emphasize, adding continuing care spaces adds capacity to our entire healthcare system. Most people move into continuing care from the hospitals, so adding spaces is critical to make sure patients can leave the hospital when they're ready. That means there's a hospital bed available sooner for the next patient who's waiting in emergency. And that means there's a space available sooner for the next patient coming in with an EMS crew, so the paramedics can get back out on the road to answer the next 911 call. It's one connected system, and we need to increase capacity across the entire system to increase access for the whole range of care people need, from EMS to surgery and other hospital care to continuing care and palliative care. Continuing care is critical, and it's a great example of how our health system has come through the pandemic. COVID-19 has taken a heavy toll on continuing care residents and home care clients and their families, and it's taken a toll on everyone who works in the system. But the operators and staff have worked incredibly hard to maintain access, and government is working hard to support them. That combined effort has kept the system working for the people who need it the most. In fact, for patients waiting in hospital for a continuing care bed, the average wait time today is now shorter than it was before the pandemic. And through December 31st, the average wait in hospital was 32 days compared to 46 days in 2018-2019. And that's because the system recovered strongly after the disruption in 2020, and placed 25% more new residents into continuing care in the first 3 quarters of this year compared to 2021. In fact, placements this year are roughly in line with the numbers in the 2 years before the pandemic. We're able to place more clients because we're succeeding in adding new spaces in spite of the strain of COVID. Our continuing care system is still there for people who need it because of the dedication of our staff and operators, and I'd like to take a moment to say thank you. And with the new resources in Budget 22, we'll build on the strength of that system. We're not just recovering from the pandemic, we're building a publicly funded health system with better access than we had before. As I said earlier, we're going to add more than 1,500 spaces in the coming year. For the longer term, the centerpieces of our capital plan for continuing care are 2 projects here in Calgary and in Edmonton. In Calgary, the new Bridgeland Riverside Continuing Care Centre is under construction. Care West will operate it with a combination of Seniors Day program and about 200 continuing care spaces. We've earmarked $91 million over 3 years to complete this project in Budget 22. This year's budget also includes $142 million over 2 years to complete the Jean Swideski Centre in Edmonton, operated by Capital Care. That centre will add 145 new spaces and replace 205 existing ones to accommodate a total of 350 continuing care residents with complex needs. In addition, the centre will offer post-acute inpatient programs for people needing rehabilitation following surgery or illness. Our continuing care system is a balance of public, independent, and community and voluntary operators. The balance is a strength of our system, and we're maintaining it, adding resources across the system to leverage the strengths of all our operators and provide choice for residents and for families. I'm excited about Budget 22 and the new spaces we're adding, and we're also moving forward with a larger initiative to modernize continuing care and meet the demands for the next decade. In the coming year, we'll move forward with new legislation for continuing care based on the review that we released last year. We've already made some changes based on that review, including phasing out ward rooms with more than 2 residents. That's a basic improvement for infection control and safety for residents. It was overdue even before COVID-19, but it's just a small first step. The review recommended a wide range of changes looking ahead into the year 2030, including more hours of care in facilities and a strategic shift to serving more clients through long-term home care. That's the right thing to do. It's better for the client and it's better for the system. It means putting the quality of life of each client at the center of the system by supporting them and living as independently as possible, which is the goal of all continuing care services. So I'm excited about Budget 22, and I'm excited about the coming year for continuing care and for our health system overall. We're going to keep building the continuing care spaces Albertans need right now, and we're going to keep working to build the publicly funded health system we need to meet the challenges of today and for the next decade. So thank you, and I'll now turn the podium over to my colleague, Minister Panda.
Thank you, Minister Carping. Good morning, Calgary. I would like to also acknowledge my colleague, Minister Carping, who joined us here together with Premier and Minister Carping. Budget 2022 is moving Alberta forward by strengthening and increasing capacity in our healthcare and continuing care systems, getting more Albertans working, and bringing our finances back into the black. As part of Alberta's recovery plan, we are investing in critical infrastructure projects to address the need for more continuing care spaces. Budget 2022 provides $2.3 billion over the next 3 years to invest in health and continuing care projects throughout the province. That includes $204 million in capital funding over 3 years to build and modernize new continuing care spaces in Alberta. Great progress is being made on 2 major projects that fall into this category. The Bridgeland Riverside Continuing Care Centre project here in Calgary is, and also as the Jean Swideski Centre at Norwood in Edmonton, both are progressing really well. And Bridgeland Riverside is an important project that addresses an urgent need for additional community-based continuing and long-term care right here in Calgary. And when completed, this project will relieve pressure on our hospitals here in Calgary and add much-needed capacity. There are approximately 70 people on site daily at Bridgeland working hard to keep this project on schedule and on budget. Construction is moving ahead as scheduled, and we have enclosed the building and framing of the West Tower, and construction activity continues throughout the project site. And later this spring, we'll achieve a significant milestone by completing the construction on the highest part of the concrete structure. And I'm extremely pleased that construction continues to be on schedule for completion in late 2023. Last year, I announced the start of construction on this project, and unfortunately, I don't think there was a single story on TV or in the print media because of COVID. But I really want people to know this is a big project and will significantly improve healthcare in Calgary. In the past, I toured media to get updated information about Calgary Cancer Center. If anybody is interested later this spring, I can organize a tour so you can share that good story with the Calgarians and Albertans. And there is also a great construction progress in Edmonton on the Gene Zwazdesky Center at Norwood Project. Approximately 450 workers are on site daily on this 430,000 square foot main building. Construction on phase one of this project is expected to be completed on schedule and budget later this year. And infrastructure projects like these important continuing care centers and other health and public infrastructure projects are happening throughout Alberta. That's all part of our more than $20 billion investments in Alberta's capital plan and Alberta's recovery plan, which is to grow our economy and support jobs. Each worker and every job site is Alberta recovery plan in real time. And every taxpayer dollar spent is designed to ensure that you, your family, your business, your community will benefit from an economic or social impact from these projects. And every infrastructure and construction-related project is supporting good-paying jobs for local workers. In the short term, this includes jobs in planning, design, engineering, and construction. It also includes jobs that ripple out from the construction workers to benefit Alberta manufacturers, suppliers, and trucking companies. These projects also keep our friends and neighbors working by supporting jobs and economic activity in area coffee shops, grocery stores, and gas stations. As these Alberta businesses see increased traffic from the work that is underway, long after construction is complete, these projects have an enduring impact through an ongoing community-based jobs in programming, operations, and maintenance. The 2022 capital plan supports investments in public infrastructure throughout the province, benefiting all Albertans. Infrastructure projects are building communities, boosting the economy, supporting jobs, and attracting investment into Alberta communities, making Alberta a destination for companies to relocate, bringing new jobs and opportunities, helping move Alberta forward to a prosperous future for all of us. Positioning Alberta to be a vital part in a bright and thriving future that will firmly secure our place as the economic engine of Canada. Thank you. Now I'll invite Karim Kasani from the Alberta Continuing Care Association.
Thank you, Minister Panda. Good afternoon. My name is Karim Kassam, and I'm the Vice Chair of the Alberta Continuing Care Association and co-founder of Optima Living, a provider of continuing care to Albertans across the province. On behalf of the ACCA, I would like to thank Premier Kenney and Minister Copping for the significant investments in continuing care announced in the Budget 2022. Our members include both nonprofit and independent owners and operators across the spectrum of continuing care, including home care, supportive living, and long-term care. Our members operate nearly half of the continuing care capacity in this province. This funding is critical to transforming our sector to not only meet the evolving needs of seniors and persons with disabilities in Alberta, but also to enhance the safety and quality of care of our residents. Albertans have clearly indicated a desire to age in grace with dignity in their own homes as long as possible, close to their loved ones and friends. Enhancing services in the community enables this, and it is a long-term approach with an equitable and seamless transition to continuing care home when required. This is a smart and sensible approach that will benefit Alberta seniors in communities across the province, and one that the ACCA supports the government in this planned transformation. The ACCA is thankful for the open dialogue we have with the Alberta Health and Alberta Health Services. We look forward to continuing to do this work with Minister Copping and his staff to create the best possible sustainable continuing care sector. Better quality of life and care for Albertans and better value to taxpayers can simultaneously be provided by working together, and this announcement is a welcome step towards that goal. Thank you.
Good morning, everyone, and thank you, Premier, Minister Copping, and Minister Panda. I'm Dr. Sid Viner, Vice President and Medical Director of Operations for Alberta Health Services. I'm pleased to be here today to speak about the impact this will have on aging Albertans. Over the last 10 years, Alberta's population of seniors grew by more than 55%. This increase is the highest among Canadians' provinces. As Alberta's population continues to grow and age, it is essential that we proactively plan for increasing care needs in the community for individuals who need supportive care environments because of disabilities, chronic conditions, or hospice end-of-life care. Part of community care capacity planning is understanding and accounting for the modernization, replacement, and refurbishment requirements of current continuing care facilities. Modernization considerations include facility age, shared accommodations, occupancy classification, HVAC, and life safety needs. The recent COVID pandemic reinforced the importance and necessity of continuing care infrastructure modernization across the province. We've been working collaboratively with our continuing care operator community to identify these needs and opportunities. The capital grant funding opportunities outlined today will assist us in addressing priority continuing care infrastructure replacements and refurbishments. This investment will help us ensure that clients and families will receive the best possible care in comfortable, modern facilities, creating updated homes for Albertans who require supportive care environments in the communities that need it the most. We are also grateful for the commitment to fund the completion of the Bridgeland Riverside Continuing Care Centre in Calgary and the Jean Zwodeski Centre in Edmonton. These facilities will provide much-needed spaces within these communities to see that aging Albertans have access to care. Providing additional funding for programming within home care, supportive living, and long-term care is also welcomed. The pandemic has highlighted the importance of keeping residents connected to their families and their communities. Additional funding will enable more Albertans to receive care closer to home by remaining in their communities as they age and their healthcare needs change. Staying connected to loved ones, friends, and family supports the well-being of our seniors and improves their quality of life. We look forward to working with contracted providers, our residents and families, and Albertans as we continue to look at capacity needs for our aging population. The care that we and our contracted providers give to Albertans is at the core of everything we do. Thank you. I'll now call upon Shauna Syverson, Chair of the Care West Board.
Hello. As the Care West Board, I am pleased to be here to share in this announcement today. The past 2 years have been immensely challenging for the continuing care operators as they've worked really hard to keep their residents, clients, and staff safe. Multiple outbreaks have taught us that we definitely need this increased investment in this healthcare sector. Today's announcement is extremely exciting for Care West and the entire continuing care sector. The fully funded initiative of the Bridgeland Continuing Care Centre is really, really exciting as it's part of our Care West family. This project will help meet urgent demand and needs for the many, many people that need us the most. In addition to the 200 residential continuing care spaces, there will also be a multitude of outpatient services. I'd like to take a moment to acknowledge the staff at Care West who have pulled together so greatly over the last 2 years. I'd also like to express my sincere gratitude to the residents, clients, and families that have trusted us, specifically in the last 2 years. Care West could not be more excited to be part of this, and we really look forward to working with Alberta Health Services, and all of our community partners as we move forward for this for Calgarians now and in the future. Thank you.
All right, with that, we're going to move to the media Q&A. We're going to start on the floor here. If any journalists are here in person and have questions, please identify your name, your outlet, and who you'd like to ask your questions to. For questions today, we have Premier, Minister of Health, Jason Copping, and Minister of Seniors and Housing, Josephine Pon. Go ahead.
My question is for the Premier. It's Tim Brooke with CTV Calgary. Go ahead. Okay. Yeah, gas prices obviously mega high right across the country. Alberta, specifically, the economy here really benefits from those high energy prices. So the question is, any plans to kind of relieve Albertan families of some of these prices, maybe considering a natural gas or a rebate similar to what we're planning with natural gas?
Well, our focus right now has been a natural gas rebate program should natural gas prices go to very high levels, as we've done in the past as a province. So the program we've designed is basically a version of something the Klein government did in 2003 that would provide a rebate for natural gas costs to home consumers at, I think, $6.25 a gigajoule. We are very concerned. We know that these gas prices are hitting everybody all around the world, not just here. And the urgent thing is for the Government of Canada to stop making this situation even worse, because they plan on April 1st at increasing taxes on gasoline through an increase in the carbon tax. This is ridiculous. And if, you know, there's a very simple thing that could happen overnight to reduce gas prices, electricity prices, and natural gas prices for home heating, and that's to scrap the carbon tax. That's what we tried to do here in Alberta. We sued Justin Trudeau over his carbon tax, unfortunately lost in the Supreme Court 5-3. But that is the single, you know, if Alberta were to provide, you know, cut the provincial gas tax, Trudeau's just going to take that up with his carbon tax increase on April the 1st. It'll be April Fool's Day for Albertans if Justin Trudeau insists on forcing up gas prices when they're at near historic highs. So we'll be bringing a motion to the Alberta legislature calling on the Trudeau government to abandon, at the very least, its planned gas tax hike on April the 1st, and once again to roll back the entire carbon tax, which is making a bad situation worse on the cost of living.
And Tim, do you have a follow-up?
So nothing planned on the provincial level at all. Obviously, Alberta, you know, benefits so much more than other provinces. So carbon tax is one thing, but as far as your government is concerned, no policy announcements coming or expected.
Again, if we were to, say, cut the provincial excise tax on gasoline, Justin Trudeau will scoop up that revenue with his tax hike on April the 1st. So I'll tell you what, if Justin Trudeau were to agree not to raise the gas tax, federal gas tax, on April the 1st, then we would look for sure at further relief here in Alberta. But a provincial cut, when he intends to increase it, leaves consumers no further ahead. We need the federal government to stop raising gas prices.
Thanks, Tim. Do we have any more questions from the floor? Thank you. With that, we'll move to the phone lines. Operator, can you please put through our first caller?
David Staples, Edmonton Journal. Hi, Premier. Thanks for taking my call. In the House of Commons this week in Ottawa, Bloc Québécois leader Yves-François Blanchet put forward a motion that was eventually adopted by the House of Commons, where it was Quebec can't lose one more seat in one more electoral district, and we can't. They decided not to reduce Quebec's political weight in the House of Commons. What do you think of Blanchet's motion in terms of perhaps favoring Quebec and disadvantaging other provinces?
Canada's a democracy. That means representation by population. It doesn't mean gerrymandering and rigging the system forever to benefit one province over another. If Quebec wanted more seats in the House of Commons, then it should have pursued pro-growth policies that would have attracted more newcomers. That's exactly what Alberta's done. Our population has doubled over the past 30 years because of our pro-business Alberta advantage. That's how you end up with a bigger voice. More people coming to pro-growth policies that deserve a full and fair share for their voices in Parliament. So this is yet another effort by Quebec politicians to stack the deck for their province. Sorry, I think we have a technical problem here. David, can you hear me?
Thanks.
David, can you hear me?
I can't hear the person on the other end. I do have
try this. David, can you hear me?
Yes.
I'll just finish that answer. Sorry, at least on the floor here we had a technical problem. I'll just say this is just another effort by a Quebec politician to rig the rules for a province that has seen population decline and stagnation because of anti-growth policies. So that's not the fault of Albertans. We've adopted pro-growth policies that have attracted a lot of people here, and those people deserve to have their voices reflected in the House of Commons, including, by the way, the tens of thousands of Quebecers who have become Albertans. They moved here to pursue opportunity. They deserve to have an equal share for their voice in Parliament, and that's something we'll fight for.
David, do you have a follow-up?
Yes, my follow-up question is, in terms of a rational, non-partisan fair way to redistribute seats when it's necessary in ridings, both provincially and federally.
Hold on, David.
What would be the process that makes the most sense, as you said?
David, just hold on a second. We couldn't hear you. We're trying to resolve. We've done a lot of these remote news conferences and never had a technical problem before, so please bear with us for just a moment, you and everyone else on the line. We'll do our best here. Testing.
Oh, there we go.
Okay, hopefully, David, you're back on the line. Are you David Staples? Can you proceed with the second question? We'll see if that works here.
In terms of a rational and kind of fair, nonpartisan process for redistributing seats at the federal level, what would you suggest?
Well, what I suggest is pure representation by population, with an understanding that there are certain floors guaranteed in the Constitution that go back to 1867 for the East Coast provinces. But Quebec doesn't have such a floor. They didn't negotiate it. It's not in the Constitution. And so if Quebec is concerned about losing seats in the House of Commons, so sad, too bad. How about instead you focus on pro-growth policies that attract people to stay in and move to Quebec? That's what we did in Alberta for 30 years. We should not be punished when it comes to the weight of voices in the House of Commons. And by the way, Western Canada has paid well more than its share into the Federation with a minority of seats. Like, we've gone through 150 years of being, in that sense, underrepresented, underweighted in the House of Commons relative to our economic power. And so that's why it's imperative for national unity that the regions that generate so much of the wealth for Ottawa have at least their fair share in the House of Commons.
Thank you, Premier. Operator, can you please put through our next caller?
Brittany Gervais, Calgary Herald. Hi, yes, thank you for taking my question. This is for the Health Minister and the Premier. Care and continuing and long-term care facilities can vary pretty greatly in the province, which meant some facilities were impacted more severely by COVID than others. So I'm wondering what is being done to improve the standards of care and conditions of care for seniors in these facilities.
Well, thank you for the question. I'll start off the answer, or start off the question, then I'll pass it over to Dr. Viner if he has anything further to add. But as you know, a very challenging time through COVID-19. We made investments over the millions of dollars in regards to provide support to our continuing care facilities, both in terms of providing wage top-ups to staff, and then additional funding in regards to HVAC units, and also in regards to be able to assist the continuing care sector with PPE and support them in actually putting in protocols to make it safer. And then this plan that we have right here, we talked about already about moving away from rooms that actually had two people per room and making capital investments so we actually go to one person per room at that point in time, and then expanding the spaces and actually looking at our, when we look at building the new spaces, how do we actually build it with a focus on HVAC to be able to protect going forward from COVID or COVID-like diseases. But Dr. Viner, if you want to comment any further in terms of some of the efforts that we're making to actually protect the safety of our seniors, particularly through COVID.
Thanks, Minister. What I would add in addition to what Minister Copping said, which really stresses the importance of the physical infrastructure, having single rooms, having double rooms, having improved HVAC, having the ability to increase physical spacing, is funding invested in home care will also allow people to stay at home, and that is also advantageous in terms of preventing infection from SARS-CoV-2 or any future pathogen that may afflict us. Thank you.
And Brittany, do you have a follow-up?
Hi, yes, thank you. Just to, follow up on that. So with that answer, I've heard a lot more on how there's going to be some improvement on some infection controls, but I was just wondering if the province is working on any measures to improve, the standard of care in the province to ensure there isn't so much, varying quality of care in different facilities.
So thanks again for the question. So again, we, as a responsibility broadly with Alberta Health and then AHS is make sure that our care operators are applying the best standards of care. My understanding is that there's ongoing discussions in regards to what have we learned from COVID and what changes that we made. Some of the conversations that Dr. Viner has mentioned, looking at how do we increase spacing to be able to lessons learned going from this. But again, our focus is ensuring that all of our care operators, and this is meet the base regulations, and we are continually working on what lessons we can learn from COVID-19 to be able to improve that, to improve the safety for Alberta residents. But Dr. Vine, do you have anything further to offer there? No, that's all. Thank you.
Thanks, Minister. Operator, can you please put through our next caller?
Carrie Tate, Globe and Mail.
Hi, thanks for taking my question. It's for the Premier. Premier, I'm wondering now that the work from home order has been lifted, whether your government will require government employees to return to the office.
Yes, thank you. The answer is yes. Effective March 1st, the policy which required either proof of vaccination or a rapid antigen test has been lifted for the Alberta Public Service. As well, the Clerk of Executive Council, who oversees the Alberta Public Service, has issued a instruction for people to return to work, but on a hybrid basis, which means that their managers will work out opportunities for people to continue to work from home on a limited basis if it does not diminish productivity. So the public service, we believe the Alberta Public Service can and will be more productive, and it's, people have accommodated the work from home requirements for office work over much of the past 2 years. But we lose something in terms of team building, culture, and probably productivity as well if everybody is permanently working from home. So there is, as effective March 1st, a policy to return to work on a hybrid basis.
Carrie, do you have a follow-up?
Yeah, just to clarify, does that mean that the Alberta government employees are already back, or is it sort of a trickle back, phasing back in?
Well, I will ask our comms team to get the exact details to you from Executive Council. I know that my Deputy Minister, the Clerk of Executive Council, sent out a memo to all public servants on Monday of this week indicating a return to work policy on a hybrid basis. But I don't know if that may be staggered in some individual workplaces, but as managers figure out schedules. So we'll get back to you on the details, but I hope and expect that as soon as possible we'll see those government office towers back with productive public servants, and that will further support the downtown cores in getting back to normal in terms of traffic and business as well.
Thank you, Premier. Operator, can you please put through our next caller?
Sorry.
Rick Bell, Calgary Sun.
Good morning, Premier. I want to ask about that further to the carbon tax, an issue that you've spoken about a lot in the past. My first question is, I think you answered this on Budget Day, but I'm still very sort of confused about where Alberta is going with the Trudeau carbon tax that we pay now. I'll have a supplementary about Trudeau cutting it, but where are we going with that? When are we going to find out a decision? What does it look like? What are the chances you're going to keep that carbon tax, the one we have, et cetera, et cetera? Are you looking at other models? Can you give sort of a very fulsome answer on where the province is right now on the carbon tax?
Yes, thank you, Rick. First off, let's be clear. Alberta's government opposes carbon taxes because we believe they just punish people for living normal lives with no meaningful environmental benefit, and that is especially clear right now with huge inflation on energy prices. This is making life unaffordable for so many people, like seniors on fixed incomes. That's why Bill number 1 of our government in the spring of 2019 was the Carbon Tax Repeal Act, and it's also why we helped to form a coalition of 5 other provinces that sued Justin Trudeau's federal carbon tax backstop. We won at the Alberta Appeal Court 4-1, but we lost at the Supreme Court of Canada 5-3. So that's now the law of the land. Whether we like it or not, and we don't like it, We have no option but either to allow the federal carbon tax to continue in the province or work out an alternative. We have been in negotiations with the federal government on trying to get the best possible deal for Alberta, or I could say the least bad version of the carbon tax, and those negotiations are ongoing. Rick, that's really where we're at right now. We've been in discussions with them for several months. We are collaborating closely with our neighbours in Saskatchewan on this because we are both opposed to carbon taxes and have very similar economies and interests. At this stage, we're seeing limited flexibility from the federal government. I would note, Rick, like our first ask here was to be able to do what New Brunswick did a couple years back, where they just reduced their, what they did was they renamed their gas excise tax, the carbon tax, the whatever they call it, climate levy. And so they just basically relabeled a tax that was already in place. So we said, went to Ottawa and said, why don't we get the same treatment? They said, hard no. And so that's the kind of negotiations that we've been engaged in, trying to get the least bad deal from a bad tax for Albertans. And we'll let you know when we finally have been able to land on something. In the meanwhile, here's hoping there will be a change in the federal government that scraps this punishing tax.
Go ahead with your follow-up, Rick.
Yes, but let's just hypothetically say that you end up landing on, which is a possibility, landing on just keeping the current carbon tax in place. Don't you think that will drive at least a few Albertans completely around the bend, that they'll have to keep, that after all of these fights and after all of this discussion, we may end up just paying the Trudeau carbon tax and losing yet another battle with Ottawa? Well,
you can count me as one of those Albertans who will be royally ticked off if this stays in place and keeps going up. Because if people think it's bad now, I mean, look, I've been blowing the whistle on this for years. The whole strategy of the NDP Liberal carbon tax was the frog in the pot, you know? You put a frog in a pot of boiling hot water and he jumps out right away. But you put a frog in a pot of cold water and just gradually turn it up from a slow simmer over a time to a hot boil, and you got a boiled frog. That's the Liberal NDP strategy on carbon taxes. They started out with a pretty low price, and then every 6 months, every 12 months, they keep gradually increasing it. And here's their actual plan, is to move it from 50 to 170. They want to more than triple it from where it's now. So if you think you're having a hard time paying your gas and heating bills now, just wait until the Trudeau-Notley carbon tax goes to its $170 a ton price. So that, you know, I hope that, you know, I think they got this in past voters in Central Canada who weren't really thinking about how much it would cost them. I think that's going to change in a big way now. So I'd like to call on our friends down east to speak up. I know the government of Ontario is with us on this. Quebec joined us in suing Trudeau over his carbon tax. So we have friends in Central Canada against this intrusion in our jurisdiction, this huge hammering consumers with higher energy prices. So hopefully if voters rise up down east, we can change this. Yeah, that's what I'm going to focus on. In the meantime, let me just say this about the options here. I don't like any of these carbon taxes. I don't think they help the environment. They do hurt the pocketbook. But the Trudeau carbon tax is less bad than the Notley carbon tax. Because the NDP here, they were scooping 40% of the revenue for their own wasteful spending. Low-flow shower heads and light bulbs and subsidies for renewable energy that weren't necessary. Whereas the Trudeau carbon tax scoops only 10%. So actually from a household finance point of view, his version is less bad than the Alberta NDP version. That's something we should remember.
Thank you, Premier. Operator, can you please put through our next caller?
Paula Tran, Global Calgary.
Hi, thank you for taking my questions. This question is for Premier Kenney. You previously said that you provided a directive to AHS to scrap mandatory vaccination policy for healthcare workers, but also said 30% of continuing care staff in some communities are unvaccinated. Why did you give out this directive despite this information, knowing that those in continuing care are extremely vulnerable to COVID-19 and might not be able to get vaccinated?
Well, first of all, what we've asked for from AHS are options, and we will be working with them to make a final decision over the days to come, and there will be a formal announcement on the final policy setting. But the answer to your question is, if you are in a rural continuing care center where you don't have enough workers to give the residents a bath, to feed them their meals, to give them proper care, that is an urgent situation we have to address. And the data is clear. With the transmissibility of Omicron and the waning effectiveness of vaccines against infection and transmission, there is no measurable difference between the likelihood of a vaccinated or an unvaccinated healthcare aide transmitting COVID-19 to each other or to a patient. So the premise of your question is frankly mistaken, because look, if there continued to be evidence of a meaningful difference in transmissibility between vaccinated and unvaccinated staff, then we would be fine with the AHS continuing the policy. But there is no such evidence about a meaningful difference in transmissibility between vaccinated and unvaccinated at this point. I hasten to add, lest people take this out of context, that there is powerful evidence about the efficacy of the vaccines in preventing severe outcomes like hospitalization and death. And that's why we urge everybody who's not yet vaccinated to get the shot and to step up for their boosters if they haven't got that yet. But again, with respect to people with a second shot, which is how we currently define fully vaccinated, versus no shot, no statistical difference in transmissibility. So the question is, I've said this from day one, the key issue here is not vaccine politics. The key issue is what is in the best interests of the patient. And if you're in some areas where there is a lot of healthcare aides in continuing care homes who haven't got the shot, and they cannot easily access rapid antigen tests as an alternative in their communities, in some remote communities, then that's putting a real pressure on their operations and their treatment and their quality of care. So this is all about quality of care.
Thank you. Do you have a follow-up?
Yes, I do. I was wondering what advice were you given that led you to issue this directive, and who gave you that advice, given many doctors and experts are saying it's a bad idea?
Well, the advice is the data, which is not confidential government data. It's very clearly data in the public domain that there is no longer a significant difference in transmissibility based on vaccination status. Now, there is a significant difference in terms of severe outcomes. But our primary focus on in the healthcare system is the well-being of the patient. And if there are areas that are underserved, unable to provide adequate care, for example, to seniors in continuing care, then we need to address that. So I think it's just common sense.
Thank you, Premier. Operator, we have time for two more. Operator, can you please put through our next caller?
Jeremy Thompson, CTV.
Hi there, Premier. I'm just hoping to sort of double check kind of what's being announced today. There's a bunch of funding, $3.7 billion for operating, then the $204 million for, upgrades and new facilities. So, but not a whole lot of details on where all those facilities will be, sort of the public-private split of that. Just wondering what you can say about the process for determining which facilities are being upgraded, where the new ones are going, when that will happen.
Okay, well, I'll invite Minister Copping and others to comment on the process. Let me just say that with an aging population and sometimes 20% of our acute care beds filled with elderly folks who would be better cared for at home care and continuing care, we need to make these investments. And the investments we're announcing today, well, this year alone, helped to create over 1,500 new continuing care spaces. This is part of our broader strategy that we committed to in our election platform to use the efficiency and innovation of the private sector to create more spaces. That's one of the great things about the Alberta system, is public-private partnerships. And it's not just government keeping a monopoly on this. So we are recreating the ASLI program, the Alberta Seniors Living Initiative program, or excuse me, the Assisted Seniors Living Initiative program, which is basically a public-private partnership. And that's one of the reasons we're able to create these beds at much lower cost. The previous NDP government killed that program and tried to nationalize all of this, and then they were building beds at $600,000 to $800,000 a bed, and of course they only wanted those beds operated in government-run unionized nursing homes. What we're doing, and so more expensive capital and more expensive operating, meaning less bang for the buck and fewer beds for the seniors who need them. So we're getting rid of the politics and ideology on this and just focusing on the practical needs of seniors by working with the private sector in the true Alberta spirit, where they typically make the big investment on the capital, and we come in behind with a commitment to provide operating grants for various kinds of continuing care and assisted living. So this is a great Alberta solution to the problem. It will also mean more modern continuing care infrastructure. Something we've learned in COVID is critically important. The catastrophe of huge COVID deaths in nursing homes in Quebec and Ontario in the first and second waves of COVID was in part because they had very old housing stock. Small rooms, shared washroom facilities, poor and dated ventilation systems, all of which led to higher levels of transmission and far higher levels of fatalities in nursing homes than we experienced in Alberta. That's because we have more modern housing stock, and that is in part because of our partnerships with the private sector. And I'll invite, I guess, Minister Copping or Panda to comment, or any of the ministers here to comment on the process of how we prioritize which project.
Thanks, Premier, and thanks for the question. So just there's multiple grant streams, RFPs that we have put out, and we actually will be developing and getting out over the next year. Just for a frame of reference, the 1,500 spaces that we're talking about, we already did an RFP last year, and this wasn't actually for capital funding; it was for expense funding. But as the Premier mentioned, a number of operators, once there's a need in a particular location that's identified based on growth, you have operators made a bid in terms of we need spaces in this particular location. We do an assessment on that, but they're bringing the capital funding. We are making the commitment in terms of the expense dollars to provide the services, but they need that to be able to go out and work with a partner to raise the funds to build this, to build the spaces. So that's the 1,500 spaces we're talking about that are being built this year. That an RFP was already done last fiscal year, and the expense dollars are in this budget to be able to fund that and get those out the door. In regards to the $204 million we're talking about, and that's capital this year, there's a number of grant streams. So one is an Indigenous grant stream, an RFP that went out for that already. We are receiving bids as we speak, and we'll go through an assessment. There will be another modernization and refurbishment and redevelopment grant stream that will go out in the very near future. And we're also in the process of developing a small homes grant stream. And again, that will be going out over the course of the next 6 months. So typically, we will do an RFP, and we'll look at cost, we'll look at ability for the providers to provide service, but also we do an assessment, a needs assessment in that particular area. We look at what is the growth of the population and the expected need at that point in time, and what is the deficit that's already in place, and that all goes into the mix and cost, and then we make the awards based on the RFP processes.
Thank you, Minister. Premier, Chairman, do you have a follow-up?
Yeah, it's a different topic here, but it is for the Premier. Basically, I want to ask you about Bill 81, which set a fixed election date for the last Monday in May next year. Wondering, as far as I understand it, there is still the opportunity for the Lieutenant Governor to dissolve the legislature ahead of that fixed date, though. Firstly, is that accurate? And secondly, if that is accurate, are you considering an early election call?
Yes, it's accurate, and no, I'm not. We ran on a commitment to create a defined election date. In the past, it was completely up to the discretion of the Premier, which I think was unfair. It gave the governing party an unfair advantage because they could, frankly, manipulate the timing to their own partisan advantage. A previous government brought in legislation to create an election period, they called it, in the Elections Act, which was over a 3-month period. And that was the case for the 2019 election. We knew it would be in the spring, but not exactly when. So in our election platform that year, we committed to establish one specific date so that everybody would know what it is. And that was another promise made and another promise kept in our democratic reform agenda. So that is the fixed date. Now, at the same time, we do live in, of course, in a Westminster parliamentary system. And so if the if the government loses the confidence of the legislature, then there has to be a dissolution. Then the First Minister, and that would be me right now, has to go to the Lieutenant Governor to seek a dissolution, given the parliamentary constitutional conventions. So that's why there's that flexibility there. It's basically just to respect our Westminster parliamentary constitutional conventions, but we have no intention of changing the date. The date has been fixed there in law, and that will be the date.
Thank you, Premier. Operator, can you please put through our final caller?
Stephanie Rousseau, Radio Canada.
Hi, my question wasn't asked in English, so I'll give it a go, but I'd like my answer in both English and in French. So yesterday you said that 50% plus 1 would be what's needed to remain as leader of your party. The UCP bylaw says you can remain as leader, but do you believe you would have the legitimacy to continue on as leader of your party with such a low result? And what kind of result are you actually hoping for in Red Deer?
Comme j'ai dit, dans une démocratie, une majorité est 50% plus 1. Et j'espère d'avoir l'endorsement des militants du Parti conservateur pour refléter tout le progrès que notre gouvernement a fait, parce que c'est beaucoup plus difficile. Je crois que les conservateurs et les Albertains comprennent que c'est beaucoup plus difficile d'être leader pendant plusieurs crises comme d'être critique. Et je crois que les militants conservateurs veulent un rassembleur qui a unifié le mouvement et pas la division. Alors, je suis optimiste à cet égard.
And do you have a follow-up?
Yeah, I was just wondering if you can say that in English for me, and then I'll ask my question.
Sure. As I said yesterday, in a democracy, 50% plus 1 is majority, and I am optimistic about receiving an expression of the support of conservatives who understand that it is a lot harder to lead through a crisis than to criticize from the sidelines, and who also understand that we need a uniter and not a divider. I think conservatives also are enthused by how much progress this government has made, implementing nearly 90% of our platform commitments and leading the country on jobs, growth, and the economy.
Go ahead with your follow-up.
I'm going to ask it in French because it's been asked in English. Sur la motion du Bloc québécois qui vise à préserver le poids politique du Québec, qu'est-ce que vous pensez de cette motion? Vous dites en anglais que vous trouvez ça injuste. Pourquoi?
Écoutez, un principe central dans une démocratie est représentation par population. Et c'est épouvantable qu'une province pense qu'il doit avoir plus de sièges que sont justifiés par leur population. Alors, tout ce que nous demandons ici dans l'Ouest et là est représentation par population. Mais il faut dire davantage que dans l'Ouest, ici en Alberta, nous produisons énormément de richesses pour le pays, pour Ottawa, pour le fédéral. Ce n'est pas juste pour les provinces avec une population qui diminue d'avoir plus de sièges qui sont justifiés par ce principe démocratique essentiel. Alors, je comprends bien qu'il y a les provinces de côte Est qui ont les garanties dans la Constitution de 1987, mais le Québec n'a pas une telle garantie. Écoutez, moi, j'aime le Québec. Les Albertains respectent le Québec. Mais nous respectons également le principe de représentation par population dans le Parlement. Et il faut ajouter que dizaines de milliers de bons Québécois ont déménagé ici en Alberta pour profiter de notre croissance économique. Et ces Canadiens d'origine québécoise ont droit d'avoir une représentation juste dans le Parlement fédéral. And for those wondering, I give pretty much the same answer I did to David Staples on that question of Quebec representation. All right, thanks very much, everybody, and thanks to our technical guys for solving that little problem. Appreciate it. Have a good day.